Our team, welcome back to Plastic Surgery Untold, greatest podcast in the world, as voted by us. Today we're talking all about the rib revolution, and so, been such a hot topic in plastic surgery as body contouring has continued to evolve, and so, it's all about shape over size, and in the past when we were talking about body contouring, especially BBLs in the lower half or kind of middle third of the body, it was mostly about how much fat we could put in the butt and hips to really give people that nice curvy, exotic shape, if you would. But now that most people are living their fit and fabulous life, you're seeing a lot more of these Pilates bodies. People still want shape, but they don't want to look overfilled. They don't want to look overdone, just super sexy, super fit. And so this is where rib remodeling is really coming to play, because we can enhance the overall shape. In the past, we used to say, whatever shape you're given is the shape that you have. There's nothing we can do about that bony framework. That's not necessarily true anymore. So let's dive into this a little bit of exactly how we do rib remodeling or rib repositioning, RibX as some people call it, and how we can actually use this to your benefits. I'm going to walk you step by step who's a good candidate, how we actually do the procedure, and how it might benefit you, because a lot of times this is done in combination with other procedures. No question it can be done as a standalone, but that's typically when people have already had a BBL, or they're just living their absolute fit and fabulous life and they're just trying to do a little bit of body contouring. You know what's super interesting is the history of ribs and aesthetics. I think this silhouette, this shape has always been something that people have talked about. If you even look back in the old days, people used to wear corsets, these Victorian queens, and having these tiny waists. There's always been rumors of these celebrities having rib removals, and it's actually a thing, just wasn't done super commonly because it was really challenging. There was a lot of risks associated with it. A lot of times you couldn't do it through a minimal incision. So much bigger procedure, a lot more challenges to it. That has all changed. And you'll see when we really jump into this rib remodeling, RibX, it's really this simplicity and innovation that's the beauty of this procedure and why it's taken off and been probably one of the hottest surgical procedures in 2025, as this has taken off like wildfire here. And so when we talk about this, it's also perfect timing because a lot of our patients want to look like this, just super fit, super fabulous. It's all about this shape over size. And so you don't want an overly done butt, but just super athletic, super fit, just a little bit of hip curves, everything that flows really nicely from the waist to the hip to the butt to the legs. And by doing that, our lipocontouring used to be able to really make a nice shape change for people, especially with the addition of fat transfer and butt augmentation. However, we were limited by where those ribs and that waist was by your natural architecture. And you're going to see a big theme in 2025 and 26 about preserving that natural anatomy and really using it to our advantage. And I think as we've had a better understanding of some of this, as technology's gotten better, we've been able to utilize that. So, why has rib remodeling been such a perfect time with this? We have so many of our patients on their weight loss revolution. They've had a limited amount of fat. They're looking for more of that athletic look. And so that has fit really, really well here. No question patient desires has driven some of this as well, as the idea of new procedures really is able to expand throughout the media very, very quickly. So super cool to talk about that. You've also can see this, even when we talk about the BBL evolution, it used to be, again, how much fat can we put in the butt? How big can we make it? That's not true anymore. Now you'll see, and we'll talk about in another episode of really, how do you make the perfect butt? This Pilates peach comes in a lot of ways, but a lot of it has to do with the combination of fat transfer for sure, or some type of butt enhancement. Could also be AlloClae, could also be butt implants, but really addressing skin laxity, addressing cellulite, so being able to smooth that out. So it's volume, it's skin laxity, skin tightening, it's cellulite, and it's that overall shape coming together. So this BBL evolution has fed in perfectly, because now that people aren't trying to be overly big, overly tight, you can really get people into a great spot, and that's going to be super helpful with this. As we kind of look here, it's really body contouring over enhancement. You can see the perfect shape here, right? So nice little waist, flows perfectly into the legs and butt. That has been huge. To be able to get people into such a great spot and really contour all of that, I think has been absolutely priceless in terms of things. When you talk about, body contouring, buttock enhancement, the change has been this. If you look at it as an overall whole, everything from the back to the waist, to the hips, to the butt, to the legs should flow really nicely. And the only way to do that is to address every portion of this, and that's why RibX has been so important, because in the past we could lipo contour this down, but a lot of our really thin patients, were already square. There wasn't anything to lipo them, so we didn't have a lot of opportunities for them. If you think about it as well, And for those really thin patients, whether we're doing RibX and AlloClae or we're doing just a tiny little bit of fat transfer in RibX, now we can make that waist a lot smaller, so a little bit of volume goes a long ways for them in terms of shaping that. So you can get that nice heart shape without having to be overly filled. When we actually talk about who's a good candidate for BBLs, this is what's absolutely fabulous. So it can be any of our skinny BBL patients, it can be a failed BBL, and I use failed BBL very, very loosely. Sometimes we just, the BBL, the surgery itself went fine. We just didn't get the shape that we wanted. Maybe we didn't have enough fat. Maybe you knew this going in. Maybe the BBL actually went perfectly, but you didn't quite get the shape you wanted because you had some of that bony framework that was extremely square. This is an opportunity to help enhance that. So that's really, really cool. You'll see that even some of our patients that have a great shape already, they just want that super snatched waist. This may be an option for you as well. You're going to see this done in a lot of our combination treatments because, a lot of things go into it. You can actually combine this with a tummy tuck, mommy makeovers, just really depending on what your ultimate goal is and what your starting point is. Because I think that's super important. We got to work towards a goal. We also got to know where we're starting because sometimes we need a few more changes to get to a good spot. Sometimes it's going to take multiple surgeries. This will help and will guide you through this. Look, when we're doing this, I'm going to walk you through it here. We'll be able to see some of this. This is what happens is we actually mark out your ribs. You're in the prone position, so we're looking at the back here. We actually got the midline down the middle, and then we can measure 7 centimeters from the midline, and we'll mark out our ribs. Because this tends to be the curvature portion of the ribs, and we can look at 10, 11, and 12. 11 and 12 most common, 10 and definitely some of our patients are looking for more of a change. Maybe some of our transgender patients. So lots of options here depending on the specific look you're going and your specific anatomy as well. This will help us get to a great spot. We actually, mark this out with the ultrasound so we can be super precise because that's what lets us make a tiny little baby incision. It'll be our little subtle secret, but it's less than an incision, less than the size of my pinky, so it looks even smaller than a lot of the lipo incisions. That's been some of the beauty of this, right? Subtle, sexy, our little secret, because we can do this through such a tiny incision so safely. I think that is what is actually mind-blowing about this new rib procedure. Most people don't even completely believe this. And when you see it here, you can actually see through the ultrasound. If you're watching us on YouTube or if you've seen one of these clips, we actually find the ribs with the ultrasound, make sure that we're in the exact place that we want to be because precision placement of that incision is absolutely key to make sure you're in a perfect spot because if not, it can be difficult to reach with some of the cutting saws. We also want to make sure that we're cutting that rib right at that inflection point because that's going to give us the biggest change, the biggest result from this, and that'll be super helpful for us along the way. If we kind of look at it here, and I'll show you this, if you're watching this on YouTube, you can see with us, but we actually free up that rib, get right down to it. We can do all this through this minimal incision because we know that we're right in the perfect spot. We know which ribs we're cutting, which ones we're changing because we verified this with the ultrasound already. Once we get to a great spot here, we can free up that some coverage because the special saw we use only cuts the rib itself. So we slide that in, we get to a perfect spot, make sure we're exactly where we want to be. Then I can cut these ribs with this ultrasonic saw. And this instrument is what's been absolutely key because the ultrasonic saw is only going to cut bone and cartilage. So it's not actually going to cut any of the other tissues. That's going to help us be in a spot that's super safe for this. When we do this, and you can see here, it'll actually cut some of the bone stuff. I can actually feel it just cutting back and forth. Perfect. That's exactly what you can see happening right in this video. If you're not watching, check us out on YouTube. Let me show you another video here. This is actually on my hand, and you can see here where we're cutting this bone, and this makes everything just perfect.
It's actually got a hollow core. This is our special saw that keeps it super safe, and so it's an ultrasonic saw, and as you can see, it's a little special vibration in terms of specific ways that cut. You see, I can run it over my finger. It doesn't actually cut anything because that's not the specific spot that it needs to be, and so we'll just run that back and forth. That's what we're doing under the skin. Once I'm in a great spot there, I freed it up, and then I can go whoop, and I just move into position. We use we use a corset that actually just shrinks it down, locks it into a good spot, and then repositions our frame, which we've never had the chance to do before.
And that's what's super key. If you weren't watching this on on YouTube. I think this is absolutely huge. The idea that we can cut this back and forth, just free up one cortex and then bend that and get into the perfect spot is what's absolutely key in terms of this. As we kind of keep moving along here, once we free this up, you can see that I can actually push the ribs down and in. And this is just pushing very the distal tip, because this is what's gonna let me contour. This is what's gonna let me get that ribs down and get you into a perfect spot, because it's really all of those things coming together that's absolutely key for improving the overall shape of this. Once we get that set, then you can have the great spot, and we'll come back to the ultrasonic saw, because I think this innovation's been huge. I think this is what's helped keep it super safe. I think this is what's made it so popular, because it gives us the precision, the control, and the safety that we all really think about for our patients. You know, a couple last things to think about this is the post-operative care, because we're freeing up these fractures, we are able to move them, but there's nothing there to hold it. So this is where the corset comes into play. You really have to be committed to wearing your corset. The more that you're going to be able to shrink this and tighten it into place, the more you work with your plastic surgeon, the better that's going to be to make sure that you're in a perfect spot with this. So I think that's super helpful. Like most splints, it's also going to help decrease your recovery discomfort as well. A couple last things when we're doing this, you know, you are going to wear that corset for at least 6 weeks, depending on whether you had a BBL, whether you had a tummy tuck. If you did other things that were putting stressors on the skin, it may be a few days before you actually put the corset on. So you want to make sure you talk to your surgeon about it. Usually anywhere from 3 to 7 days, just making sure everything's healing really well before we put it on. That way we make sure you're in a great spot with all of that. You know, last things here is just, you can see such the transformation you can make. Here's a really thin patient. She's in a great spot. She looks great, you know, has a nice butt to begin with, just feels really square, which a lot of our patients feel. So we did some LipoSculpting, some targeted fat transfer, RibX to bring everything together. And the idea is the transformation you can make when you combine all of these. She has a perfect sweetheart shape. She looks fabulous, but really stems from that waist coming in, flowing into the butt and hips to give her that perfect shape. So RibX explained. Hopefully this has been super helpful for you guys. We'll see you soon. All right, bye.